This podcast is not a replacement to any formal lectures or clinical placements. Hello and namaste to all. Welcome back to our podcast. I'm Anisha.
And I'm Kabita. And here we will have discussion on different clinical cases in this case series.
Welcome to the case series episode 2. A 12-year-old boy with history of dog bite.
A 12-year-old boy is brought to emergency department in an hour after getting bitten by an unknown stray dog in his left thigh.
Oh, poor little kid. What was he doing at that time?
He was playing with his friends in the playground 2 miles away from his home. He was running after his ball when he was attacked by the dog from his left. He says that he didn't notice the dog running towards him, and also his ball hasn't hit it either.
So, it is an unprovocative bite?
Yes, that's what he says.
Okay, looks like he needs post-exposure prophylaxis for rabies because there is a possibility that the dog might be rabid.
I am also thinking same. Let's see what it says about the wound.
Yes, please read it out.
There are multiple transdermal bite and scratches on his left thigh at the lateral aspect. Bite wounds are surrounded by red, swollen and painful areas of abraded skin.
It means the contact belongs to category 3 according to the WHO classification, which includes single or multiple transdermal bites or scratches or licks on broken skin, contamination of mucous membrane with saliva from licks or contacts with bats. Okay, Kabita, tell me more about the case.
Sure, the patient has no history of previous animal bites nor pre-exposure prophylaxis for rabies. And the question is, how will you manage this case?
Okay, the kid has severe type of contact, so immediate vaccination and administration of rabies immunoglobulins along with local treatment of the wound are recommended as the post-exposure prophylactic measures to manage this case. This seems simple yet very important.
Yes, every person with a bite from suspected rabid animal must be given post-exposure prophylaxis. Few years ago, my brother also had a dog bite with minor abrasions only. I remember that there was no bleeding, so doctor treated wound and gave him vaccine only.
That is because he had category 2 type of contact. Had he had category 1 type of contact, only the local treatment of the wound would have surfaced.
Anisha, why don't we discuss on rabies itself first before we move on to details of management?
Sounds great. Let's do it.
Okay, I would like to define rabies as a vaccine-preventable viral zoonotic disease caused by Lissa virus type 1, a bullet-shaped neurotropic RNA-containing virus.
Yes, it is preventable, but if not managed in time, it is always fatal. It is transmitted to man usually by the bites or licks of animals like dogs, cats, jackals, wolves, as the virus is excreted in their saliva.
The virus replicates in muscle or connective tissue cells at the site of introduction from where it is present typically via peripheral nerves to our central nervous system. And after infecting the system, it is present centrifugally in peripheral nerves to many tissues including muscles, nerves and glands.
The incubation period is highly variable, commonly 1 to 3 months, after which the patient starts developing prodromal symptoms like headache, malaise or sore throat. This is followed by widespread excitation and stimulation of all parts of nervous system.
The patient develops aerophobia, hydrophobia, increased reflexes, and violent spasm of neck and pharyngeal muscles. Hydrophobia is pathognomic of rabies, in which initially swallowing of water provokes the spasm of muscle. Later on, it becomes so severe that even the sight of water may provoke the spasm, making the efforts of swallowing difficult.
There is no specific treatment, so death is more likely to occur in due course once the symptoms start to manifest. Death may occur abruptly during one of the convulsions or may follow the stage of paralysis and coma. Globally, as of 2019, there are only 30 people on record who have been stricken with rabies and have survived.
That's why the prime focus should be on prevention of the disease.
You're right. Now, moving on with this 12-year-old kid with severe type of exposure, he should receive post-exposure prophylaxis with the aim to neutralize the inoculated virus before it can enter the nervous system.
Yes, we should start with prompt and adequate local treatment of wound. If possible, it should be done immediately after exposure.
And everyone should be aware about this.
The wound should be immediately flushed and washed with plenty of soap and water, preferably under a running tap for at least 15 minutes. After this, virucidal topical preparation like povidone iodine should be applied on it.
Suturing of wound should be avoided. If it is unavoidable, it should be delayed for 24 to 48 hours and only minimum stitches should be applied under the cover of rabies immunoglobulins locally. Administration of intramuscular tetanus toxoid should not be forgotten.
Antibiotics may also be recommended. Now, regarding immunization, rabies immunoglobulins should be given into and around the wound site, that is, left thigh of this kid.
Rabies immunoglobulin is indicated only once as early as possible and not beyond 7 days after the first dose of vaccine. Lastly, for rabies vaccine, we have to follow the national guideline. Kabita, can you elaborate the guideline for this case?
Yeah, sure. The government of Nepal has recommended 1 week 2-site regimen using cell culture and embryonated egg-based rabies vaccines. On day 0, that is the day of exposure or dog bite, 2 doses of 0.1 ml of vaccine are administered intradermally over the deltoid area of each arm, that is, at 2 different sites. This is repeated on day 3 and day 7 as well.
This means the kid needs to have 3 hospital visits in total for this regimen?
Yes, and this completes the management for his wound.
Okay, so we have learned about rabies and its post-exposure prophylaxis specifically for category 3 type of contact. There is also pre-exposure prophylaxis, and for animals, different prophylactic measures are followed.
And we need to be aware of all these.
Now, we have come to the end of this episode. Hope you had great time listening to us. See you again in the next discussion. Until then, enjoy learning and take care.
Goodbye and keep learning.